and welcome to our next episode of the Hormone Café. Today I want to talk about inflammation and fertility. Inflammation is a word that we use a lot, but there are a lot of different sources of inflammation. So today we're going to talk about 5 sources of inflammation, how we treat them, and how we tackle them to promote optimizing our hormone balance and optimizing our fertility. So we'll start with autoimmune, gut, endometriosis, infection, and allergies. So one thing that's really important is that there are various types of autoimmune or pre-autoimmune conditions that can affect our fertility. And autoimmune diseases are when the bad parts of our immune system are attacking the good parts of our body. One important autoimmune disease to check for is Hashimoto's thyroiditis or Graves' disease. This is when your immune system attacks your thyroid, and that can make your thyroid be hyperthyroid, meaning it's working too hard, or hypothyroid, meaning it's not working hard enough. When we check that, we usually do a blood test for something called TPO antibodies and TGA or thyroglobulin antibodies. If you have positive antibodies, then we also want to make sure we check a full thyroid panel. So your TSH, your T4, your T3. Sometimes we'll check a reverse T3 as well to see what are those antibodies doing to your thyroid. Are you hypo or hyper? So autoimmune disease like Hashimoto's or Graves' disease, that can really affect our chances of getting pregnant and can also increase our chances of miscarriage. So that's definitely something that we want to check for and treat. The other types of autoimmune diseases are, there can be pre-autoimmune diseases such as lupus, rheumatoid arthritis, where we don't have the full-blown symptoms, but we have the proclivity to those symptoms. So if you're a patient who has joint pain or joint stiffness, especially when you wake up in the morning, or if you get rashes often, or if you get hives or swelling that isn't making sense, it's definitely helpful to get blood drawn and look for inflammation markers. For example, we check something called an ANA or anti-nucleotide antibody to see if you could have an autoimmune condition or predisposition that can be affecting your fertility. And there's other inflammation markers, something called a CRP and an ESR, that can really put the whole picture together to see if there are autoimmune issues that we want to tackle. So from an autoimmune standpoint, the core principles are that we have an anti-inflammatory diet. So the core of that is avoiding sugar, so things like pure cane sugar, brown sugar, honey, agave, avoiding processed or white carbohydrates, avoiding simple sugars, and then really prioritizing those long grains, whole grains, high quality grains. So wheat, rye, spelt, barley, einkorn, buckwheat, quinoa, flax, beans, fibers, and whole grains are essential to helping heal that inflammation. Because of course, when we're thinking about autoimmune or even pre-autoimmune diseases, diet is the core of everything that we do. And then on top of that, there are medications. So for example, sometimes we'll use things like low-dose naltrexone to really help decrease inflammation. There's a lot of data coming out about semaglutide and other GLP-1 receptor agonists that can help decrease inflammation as well, that we'll use sometimes. And then steroids can be really helpful. And then there are other immune modulating medications, for example, hydroxychloroquine and filgrastim is another one, or tacrolimus. There are certain medications that we can really help modulate our immune systems. We also use injections or infusions. So IVIG is another one that helps support our immune system if our immune system is low or down. So lots of things that we can do to help with either autoimmune or pre-autoimmune disease so we can optimize our body's ability to ovulate. Because if we're inflamed, then our ovaries are going to have a harder time ovulating, and they're going to have to ovulate through inflammation. And then if our fallopian tubes are inflamed, it's harder for the sperm and egg to travel down the fallopian tubes. And if our uterus is inflamed, it makes implantation harder, and then it can increase risk of miscarriage in that first trimester. So that's why we care so much about inflammation, and why there are multiple levels of treatments that we use depending on the source and type of inflammation. The second place that we can have inflammation is in our gut. Our gut is very, very important. So key triggers that you might have gut inflammation are if you have abnormal bowel movements. So if you either run really constipated or you have really loose stools, both of those are not good signs. Or if you feel bloating or have stomach aches every single day. Sometimes patients say, oh, my gut feels great. I don't have any issues at all. But they have subtle signs. For example, if you're a person who you're taking a bunch of vitamin D and you've been taking it for years, or you're taking a bunch of iron and you've been taking it for years, and we check your levels and they're consistently low, then we worry, is there something going on with your gut? What is affecting your body's ability to absorb those? Why are they not showing up in your blood appropriately if you've been supplementing? So some of those can be subtle signals that you might have inflammation in your gut. Big signals are things like if you have blood in your stool, that is something that we really want to get checked out. So we do a comprehensive gut health test, and things that we look for in that gut health test are something called secretory IgA, calprotectin, and eosinophils. So any of those three things being positive means that we can have inflammation in our gut. So of course, the key always to managing inflammation is diet, but the specific things that we want to look for is what the inflammation is coming from. The most two common causes are that it's coming from food, something that we're eating, or that it's coming from an infection. So we can do a stool culture to see if we have an infection. So there can be all kinds of bacteria that can grow in our gut, things like Klebsiella, E. coli, Salmonella, Proteus, Siderobacter, and those can either be treated with antibiotics or herbal antimicrobials. So we can use things like berberine, oregano, uva ursi to treat some of those gut health infections, or we can use antibiotics if you have a significant infection or significant symptoms to decrease that gut inflammation. And then, of course, there are supplements that we use to promote gut healing, like NAC or N-acetylcysteine or IgG. Those can be really excellent for a leaky gut and promote the integrity of our gut lining to help heal some of that inflammation in our gut. And then we also recommend doing an advanced food sensitivity test, because there are a lot of foods that can inhibit your body's, there are a lot of foods that can directly damage your gut and cause damage to your gut lining. For example, I had a patient the other day who had really bad bloating and she had really bad skin issues, and we did a food sensitivity test and it came back positive for peppermint. And she said, oh my goodness, Dr. P, I literally used peppermint lotion on my skin every single day, and I was drinking peppermint tea every day. And once she found that peppermint was damaging her gut lining, she cut out her peppermint tea, she stopped using peppermint lotion, and she said, oh my gosh, my skin completely cleared up. I was having all these rashes. I had no idea what was happening with my skin. Now my skin is better than ever, and I don't have any bloating or any gas, and I poop every single day. So sometimes it's really important to find those really specific things that could potentially be damaging our gut. So when we think about our gut, the whole goal is to eliminate anything that could be damaging it, working to heal our gut, whether that's through supplements or especially fiber. And then once our gut is healed, oftentimes we can reintroduce some of those things that were damaging it, because now our gut can tolerate them better. Or if there's something that's truly damaging long-term, we know to cut that out. For example, sometimes we can introduce gluten back in, and sometimes it's important to be gluten-free for life so that gluten isn't continuing to damage our gut. So doing specialty testing and really paying attention to our symptoms and those subtle signs of our body can make sure that our gut is not a source of inflammation. The third source of inflammation that's really important is endometriosis. Endometriosis sometimes can cause really bad pain during our cycles, sometimes can cause other subtle symptoms that aren't totally making sense. For example, significant pain when we ovulate, pain in our lower abdomen or near our bladder, for example, pain when we have bowel movement. And sometimes, of course, endometriosis can be silent, meaning that we don't have any pain, we don't feel any problems in our pelvis or have any pelvic issues, but there can be really subtle inflammation or growth that can be causing issues that we never knew. For example, I just did surgery on a patient who said that she wasn't having any pain and she was feeling great. And I did surgery, took out a lot of endometriosis all throughout her pelvis. She had her first 2 periods and she told me, Dr. P, this is the best decision I ever made. I'm so glad I had surgery. I feel amazing. I had no idea. I thought that I was quote unquote normal and that I wasn't having any issues. But now that I've had my endometriosis removed, I realized that I was having issues that I thought were normal this entire time. For example, she actually was having really painful periods and really, really heavy periods. And she was having a lot of bladder pain and a lot of irritation with intercourse and pain when her cervix was touched, and she just thought that that was normal and she didn't have anything else to compare against. When her endometriosis was removed, what she thought was actually normal turned out to be pain from her endo, and she felt amazing and better. So sometimes that can be hard to diagnose endometriosis, but you really want your period to be completely pain-free. You want intercourse to be pain-free. You want to have a really healthy vaginal tissues and not have any pain, irritation in your bladder or pelvis or vagina, or pain when you have a bowel movement. Other signs are if your hormones are balanced and you've been trying for more than 3 to 6 months and things aren't making sense, then we definitely want to test for silent endometriosis. What endometriosis is on the outside of our uterus and on the outside of our ovaries, sometimes on our fallopian tubes, on our bladder, on our rectum, other places in our pelvis, we can grow inflammatory tissue. It's where the endometrium, which is the inside lining of the uterus, is supposed to be growing on the inside of our uterus, but it's actually growing on the outside uterus and our pelvis. And this is just slowly inflaming us, and it can over time cause scar tissue. So that can inhibit our body's ability to function properly. It can inhibit our ovulation, and it can also, if it's damaging our ovaries, it can really hurt our egg quality and contribute to miscarriages. So not only does it hurt ovulation, but it hurts our bodies, our ovaries and our our egg and our sperm's ability to travel through the fallopian tubes. And then it can also impair implantation. So endometriosis can cause a lot of long-term issues that affects our hormone balance and our fertility. So there's 2 ways to check for endometriosis. One, we can do an endometrial biopsy. It's called myreceptiva. There is a protein that's called BCL6, and overexpression of that protein points toward having endometriosis. So we can run a test to see if you have endometriosis, or sometimes it's helpful to do surgery to look in and see if you have it and then go ahead and remove it right then and there. And then, of course, whether we do a test or we do surgery, long-term management of endometriosis is extremely important. So when I do surgery, I always put patients on things like omega-3, NAC, curcumin to make sure that we're managing their inflammation chronically, and that we always manage the hormones, make sure that we're not running estrogen dominant or low estrogen, progesterone dominant or low progesterone, because hormonal imbalances long-term, they can grow endometriosis back. Along with endometriosis, we always want to pair those autoimmune testing and that gut health testing because they're all related. Sometimes people can have autoimmune component to their endometriosis, and endometriosis can flare your gut and cause a leaky gut, and the other way around. There's a huge connection between your gut and inflammation from endometriosis, because sometimes we do surgery, we remove endometriosis, but if we haven't addressed our gut issues, then we're not going to feel as great as we can, because we want to tackle that gut inflammation too. So the 4th cause of inflammation is infection. The most common places that we see infection, for example, are in the vaginal tissues. So it's important to do a comprehensive vaginal swab to make sure that we don't have a vaginal infection. Oftentimes, we don't have any symptoms at all. We can grow multiple species of bacterial vaginosis, Prevotella, ureaplasma, and not have any symptoms. Or we can have cervical infection, which is called cervicitis. So we can have inflammation or infection inside our cervix that can cause decreased cervical mucus or too much discharge. So that's important to evaluate either through an ultrasound or a culture or an exam. And then we can also have endometritis or infection in our uterus lining, and that's evaluated by doing an endometrial biopsy and sending it for cultures, white blood cells, something called CD138 stains. And then we can also have pelvic infection or PID, pelvic inflammatory disease. Sometimes patients describe this very diffuse pelvic pain as if They can't quite put their finger on it, but their pelvis just kind of hurts. I just had a patient who was postpartum and she said, Dr. P, I have this pain all the time and it's really subtle, but it just feels very sore and it hurts me and it hurts to have intercourse. And I said, okay, well, there's two options. One, we can use antibiotics to see if we can treat some of that inflammation, or two, we can do a test and see if you do have endometriosis. And she said, I just want to take antibiotics because I really don't want to undergo a biopsy. And we gave her a round of doxycycline, and she, after 14 days, she said, I feel amazing. That pain is completely gone. And she was so much better. So there's multiple options depending on your goals and how you're feeling and what your preferences are for treating infections and inflammation. Other infections can affect us too. For example, if we have a sinus infection, if we have bronchitis or laryngitis, if we have pneumonia or any type of infections in our body, if we're doing dental work and our gums are inflamed or flaring up, or we have abscesses. Because one thing that we have to remember is our body has a certain amount of nutrients, because what we put into our body gives us a little nutritional package. And depending on what's going on in our body can divert those nutrients into different pathways. So for example, if we're not infected or inflamed, we're not stressed, our body's not in fight or flight, we'll divert all of our nutrients into making thyroid hormone, for example, and our women's health hormones like our estrogen, progesterone, testosterone. But if we're in fight or flight mode, then our body's going to divert those nutrients into making cortisol, for example. Or if we're inflamed or infected, our body's going to divert nutrients into curing and healing that inflammation, and that can really suppress our hormone production. So that's another reason that we really care about infection anywhere in our entire body and inflammation. So it's important to do the little things that support our immune systems, treat infection as quickly as possible. Of course, as a holistic physician, I tend to use antibiotics very sparingly, but there are some conditions where it is really important to use antibiotics because it's important to get that bacterial load down as quickly as possible so our body can heal and divert its nutrients into making hormones instead of diverting nutrients into chronically treating and working on that infection. And then antivirals and antifungals are the same. We can have bacterial infections, we can have fungal infections, we can have viral infections. So paying attention to all those different body systems is extremely important. And then the last thing that we want to think about with infection or inflammation is allergies. It's very important to really have your allergies under control because allergies can be a huge source of inflammation. I just had a patient who I was talking to her and she was saying she was struggling with fertility. She had been to a number of doctors. Everybody kept telling her that she was normal. She just needed to keep trying. And so I started talking to her, and I always ask people, for example, do you have any sources of inflammation? Do you have rashes? Do you have any allergies? And she said, oh my gosh, yes, I have horrible allergies. And I said, okay, tell me more about that. And she said, I have really, really bad allergies and I'm literally allergic to everything. And I don't really want to take medication. So I've just been powering through. So we talked about her allergies, and with allergies, the important thing is obviously to figure out what exactly you're allergic to see if you can avoid any triggers. So it is important to do allergy testing to see if there's something that we can be avoiding. But sometimes we just can't avoid it. So if we're living in a certain state that has certain pollens and we're allergic to those pollens, or we're allergic to grass, or we're allergic to our dogs or cats, sometimes we can't avoid that, in which case we really want to look to treat some of those underlying causes and do allergy shots and help retrain our immune system. But in the short term, it's really important to manage that inflammation and manage those histamine levels. So that's where things like our Zyrtec and our Allegra and our Claritin can come in really helpful. And there's a ladder of allergy modulation that we use. So we start with antihistamines, and then we can move toward things like Singulair and Cromolyn and steroids and a ladder of interventions and medications, because the whole goal is to be completely allergy free. Because if you're allergy free, that's less inflammation, and that can definitely help your fertility. So this patient that I had with the allergy, she said, oh my gosh, I had no idea that allergies are affecting my fertility. And she took 2 different allergy medications until she was completely symptom free every single day, and she was pregnant in 2 months. And she said, oh my gosh, I didn't realize that this inflammation was having such an impact on my hormones and infertility. So if you're a person who has allergies, please work to make sure that they're under control. And of course, we want to get inflammation as low as possible from a nutrition and supplement level, but sometimes that does require medications. And then long term, we want to think of a thoughtful approach of how can we maintain our retrain our immune systems so that our allergies are not flaring up, so that we can live every single day without having any itching, watery or dry eyes, or coughing, or anything like that. So if you feel like any part of your body is inflamed, please advocate for yourself. Do not hesitate to get a full evaluation. Pay attention to all the different body systems. Yes, your reproductive organs, but everything else as well, right? Your sinuses, your lungs, your throat, your dental hygiene, your oral health, because there can be inflammation in a lot of different places. And the more we work to tackle that, the better your hormone profile is, the better your ovulation, and the better your implantation. We are happy to help you with an evaluation. Don't hesitate to give me a call. Check us out, verafertility.com. Thank you so much for joining us today on this episode of the Hormone Café, and please stay tuned for our next episode.